This exercise I'm just calling knee bending and straightening, laying on your back. I don't have a fancy name for it, but it can be a really helpful tool to restore knee flexion after a knee injury or surgery, particularly when there's a lot of swelling. So you're gonna lay on your back and bring your leg up into this position and just totally support it with your hands. If you can't quite reach there, you can get a belt or a strap or a towel and you can hold it there, but you're gonna get it pretty straight. I like to just have the foot pointed up so there's not as much nerve tension in the back of the leg. And then you're going to slowly let gravity bend it to your comfort level. So if you start to feel a little tightness or pain, or it feels like that's as far as it wants to go here, pause there for about 2-3 seconds, take a breath and exhale. And then on your inhale, straighten it back up. And so we're going to lower down slow, get to that end point. Inhale, full exhale, come back up. So why the breathing? So I'm incorporating that intentional breathing, inhale, and maybe even a little slower exhale, because that helps to decrease sympathetic nervous system activity. So our sympathetic nervous system is a part of kind of the operating system of our body that gets activated when we're in pain or have an injury. The system's often called our fight or flight system, but it's also what gets revved up when something hurts. And it can cause muscle guarding and tension. And so sometimes this range of motion is limited by swelling or the joint, but sometimes it's actually just the body unconsciously guarding something that hurts. And so if we inhale, slow, exhale, that's a signal to the nervous system that we're safe, we're okay, and then I can start to allow this to move a little bit more. If I hold my breath, that's a signal that I'm potentially unsafe. Imagine you're walking on thin ice or something slippery, or in an area, a sketchy alley where you're a little afraid. You're going to tense up and maybe hold your breath or breathe shallow. Your nervous system senses there might be potential danger or instability or something. The same thing is true here. So anytime we're trying to restore motion, I don't like to force it into pain. We go to just your tolerance, but we incorporate some slow, deep breathing. And I find it can go a long way to both kind of help. The motion is going to help clear the swelling. This elevation will help clear some swelling. And then the breathing and the slow lowering into it can help to down-regulate some of that protective nervous system guarding. I typically do this for 2, maybe 3 minutes, somewhere 20 to 30 reps. You might start to feel your quad getting tired. That's okay. You can try and straighten the knee all the way in this position. But really, we're working on slowly lowering into a deeper bend.